Welcome, everybody, to the show. I'm back from a meeting in Scottsdale, Arizona, and I have a special guest today, Tiffany Blackmon, a patient of mine who's over a year out after her explant, but she has a very special story that I want you to hear. Tiffany, a unique patient that I know that there's more patients with her specific problem, and it's not just associated with breast implant illness or symptoms of breast implant illness, but it's the thing that always worries me, breast cancer. So having had my sister recently pass away from breast cancer, I've always been uniquely positioned in my career to take care of those patients and be obviously sensitive to the all the things that come with that. Actually been called by my sister when I was in medical school about it. So that's a whole separate story. But welcome to the show, Tiffany. I'm very looking forward to our conversation.
Well, thank you so much for having me. And you saved my life, and you changed my life and saved my life. I say that so many times to you, and thank you.
And I don't do a really good job of acknowledging that, and I thank you very much for that. I've never been one to accept compliments, especially in the face of doing what I always considered, which was my job, take care of patients with cancer. So for everybody listening, I did almost 20 years exclusively of practice devoted to cancer care and trained for another 9 years before that. So it's a fair number of years just taking care of patients who needed oncologic reconstruction or help with the problem with surgery after cancer or complications from their treatments. So let's get into it. Tiffany had breast augmentation in 2011, and I want her to tell what I feel is not an uncommon story in a sequence of events that can play out in a patient getting a breast augmentation. So Tiffany, tell us your experience with breast augmentation, maybe why you had that versus a fat transfer, if that was even discussed, and maybe placement of a device. Was that discussed with you, like above or below the muscle and the ramifications of that?
No, actually, so 2010, 11, I decided to do this. I was on the fitness circuit and just thought that that would help me. And for the wrong reasons, obviously, I can say many years later. But I did interview a few physicians, and no, under the muscle, over the muscle wasn't deterrent. It wasn't talked about. The big buzzword in 2011 is, from what I was hearing from the surgeons I was talking to, was gummy. What am I trying to say? Gummy.
So let's pause just for the audience. So before that, the filler, the silicone filler, could have been more like syrup, less like Jello. So they came up with the term, coined the term gummy bear.
There you go. So I didn't know anything about size. I just didn't want to be massive at the time. But anyway, we went through with the surgery. And when I had the surgery, I was obviously very large when I came out, but it was the swelling and everything, of course. But then one encapsulated pretty quickly. And so I went back. There was no fat transfer talk of that. I mean, the first time I heard about that was through you in your office. But went back for the encapsulation, and I said, you know what? Let's just not do this. This is just not what I wanted. And this was in months. And the surgeon said, if we don't put them back in, you won't look right. You won't. You just can't do that. And so I believed him. And so we went smaller, had the reconstruction at that point. And it's interesting, right after that, I started feeling poorly. And I mean, I'm an athlete. I was training. I was in great health, food, and just the wheels just started falling off. And it was, oh, you're in perimenopause.
So let's, for a moment, everybody has to understand this is key. You need to understand when you started feeling poorly, so then you can relay that to someone like me. If you're coming to see me, I'm going to hear that. I'm going to hear you had a revision. I'm going to automatically think this is infected.
Oh, yes. So immediately I had this done, recovered, and then started back in my training, and it was back pain. It was joint pain. I couldn't sprint like I used to. I just one thing after the other, just falling down in the kitchen floor with sciatic pain, which was unexplained because I was perfectly healthy. I had a neck surgery in 94, but it was lumbar and joint and feet. And then just started, and I lived in Austin. So, the allergies I mean, it's just, I mean, you just think, oh, it's just allergies.
All the things there.
That's what we said today. It's just allergies. But yeah, it was very soon after it was inexplicable of things going wrong with my body. And again, never put two and two together, never even thought about having an infection or a reaction to my implants at all.
And so, like, for everybody listening, so this has taken me many years to have the ability to sit here and listen to that, even brief history she just gave, and really know for a fact that what we're going to talk about later was what happened at that revision. So I guess I should start this way. I think there's this, oh my God, I spent all weekend at a meeting discussing how mold is not in implants. All right. So I'm gonna myth bust right here. Number one, like, mold is not found in an implant. So the only way that could even potentially happen is if it was a saline filled implant. And I know that's how the internet works. Like, it's got to be a moldy saline implant. So we've tested, and I test every single device. The scar capsule around the device gets tested, as was Tiffany's, and then everything gets it for pathology. Those are very distinct, processes that we have followed for the entire time I've done this procedure. But it is uniquely important in Tiffany's case. But when I hear her story of a placement, a revision, and then a lot of symptoms, I immediately think she has a problem with an underlying infection. And so now she's going to go through probably a prodromal phase where she doesn't develop a red breast or red chest, but she does not feel well and has a lot of symptoms that all are akin to chronic inflammation. Those, I'm sure, are going to become very interesting.
Very interesting. The pain was first, but then the GI issues. I mean, again, here we go again with chronic GI issues. And I would treat it, and then it'd go away for a year, and then it'd come back with a vengeance. I mean, the GI and the joint pain was the worst. And then years later, I test positive for an ANA marker with autoimmune. And that was in 2020. So all those years later, and I don't know if I had autoimmune when I had the implants in, but it peaked its head in 2020. But yes, I mean, I'm telling you, I'm a very healthy woman, and one of the healthiest I know, and eat well and eat clean. But then what happened? It was so odd, so odd. And I didn't even think about what had happened to me until I found you in 2023.
So everybody listening, that's a long period of time to cope with what is a chronic inflammatory process. And we'll get into the science behind that. So, when I have a patient come with Tiffany's story, I've already in my head, okay, so this device clearly probably has bacterial contamination, underlying infection, however we're going to describe that. The next steps are, what can we do in a sequence of events? So I recently published my book, Sharp, about our process regarding recovery that can be used for all sorts of surgical procedures, including orthopedic surgery, cardiac surgery, cosmetic surgery, plastic surgery, breast cancer reconstruction surgery. It doesn't matter what type of surgery you're having. The program is really set up to understand how someone detoxes through their genetics, then look at their toxicity burden, coupled to other things like gut health, food sensitivities, hormone balance, and now we've added metabolomics. And that really sets up my detox team to help work with Tiffany in this instance regarding, that plan, a surgical plan and a supplementation plan. The supplementation plan is very specific in my patients to up level a series of things that I've identified in your genetic code as it relates to detox. So we get our patients started as soon as we can on those programs, because I never know when someone like Tiffany is going to be able to travel and come stay. She brought her daughter and got everything organized. And, I'll let her detail, her experience with our process. But that's how I think about there's 3 things that I have to do plan wise for each patient.
When I did reach out, I heard you on another podcast because I actually had a explant scheduled in Fort Worth, and I was being treated for collagenous colitis, and I was on steroid treatments for 3 months. Went in for my pre-op, and the surgeon, bless her heart, said, "You know what? I can't do this to you because you're taking steroids. You have to be off for X amount of time." Devastated. I was like, I want these out so badly because I had another friend that had gone to her. And so I was just devastated. So then I started digging and I found you through another podcast. But I'm so blessed because of what happened to me and what you found, because this surgeon, that's not her expertise, is explanting, and she was not taking the capsule out. So there wasn't an end block in her protocol. Well, I did a query online with breast implant illness expert, and on Monday morning, Megan called me and she went through the diagnostics, and I was in your office in July. And when I saw you, have you been around mold? And I don't know if I really shared my story about the encapsulation at the time I saw you in July, but you asked if I'd lived on a lake and if my house I had mold. Yes, we had a flood, and we lived on, near Lake Travis. When you said that and talked about what you needed to do or what your team needed to do, you're like, okay. I remember looking at you going, what? You said, we can do it Halloween. I went, what? And I knew you were booked, but it was your process of getting me prepped for surgery as well. Correct? I mean, it was going to take a while.
Right. And it depends. I mean, we have hired another surgeon now. So Dr. Chung is here to help offset what is a delay, sometimes in getting on the schedule. And for everybody listening, Tiffany has a very unique story, but what's more unique was her mindset going into it. She has a very clear understanding of her expectations, and that's what you have to do. Like we're not talking about the elephant in the room here, but everybody who is seeing me to have this done really doesn't want to have surgery. So
Yeah.
nobody comes to me wanting to have surgery. And I always I say this when I speak internationally, nationally, locally, regionally, whoever's asking, me in person, online. I don't tell anybody to get an explant.
Yes.
That's
Exactly.
not my job. My job is to explain to you what I understand and what the literature shows, including literature I've recently published, or what I clearly understand is contributing or may be contributing factors to chronic inflammation, of which the breast implant is a part of. But if I hear her story, I immediately have and feel more aligned with what I can do to help. And when we say prep phase, Tiffany's talking about starting supplementation. Many people need to adjust their diets. You're going to come on board with me. You're going to pause your supplementation because although I appreciate it and don't want anybody to throw their supplements away, I really don't care about who's providing them. They are not aligned with exactly what we know regarding this problem. So we have a very specific setup for this problem. We run it for a year. And then, so we get started with that. And then we have testing that takes, it can take 2 to 8 weeks to turn around all the different tests, because these are not blood tests. Some are DNA tests through saliva, urine, stool. So there's different testing done to build out a picture for you. And much like, we'll give a shout out to Dr. Hyman is doing with Function Health. The thing is, you're trying to take what is being missed by standard laboratory testing to understand why Tiffany or any of my clients are experiencing so many symptoms. And we can dive into exactly why that is happening, as I have plenty of information regarding that. And then we get to surgery. It's purely anybody can have an explant. Anybody can typically have an explant and a lift who's had children, has breast sagging, excess skin. The nuances come after that with fat transfers. Fat transfers get a bad rap because the internet's undefeated and most people on the internet are fucking stupid. So I'll just say that out loud because you don't know what you don't know. If you haven't done a fat transfer, you shouldn't talk about a fat transfer. If you never actually implemented that in your practice as a plastic surgeon, I'll just give everybody listening something to think about as a surgeon. I've done thousands of fat transfers for cancer patients and cosmetic patients. They work extremely well. Your problem is you don't understand the physiology of the patient you're taking care of. The closer the patient is to 20, the easier it is to take care of that person. The closer they are to 80, the more inflammation they have, the more limitations they have, hormone imbalances, gut health problems. That will breed variability in your results. So that's a long way of saying is it's nicer to do it earlier on, a certain, patient in this instance when their hormones are normal, probably less things going on, haven't had children. That's why the Brazilian butt lift is such a popular thing. Nobody's having an uproar about the butts getting fat, but for the breast, it's some like, oh my God, we can't do it, or it's not going to work, or like, why? What are you talking about? So once we get a supplement plan, surgical plan, and detox plan, that's really when you turn over the hourglass and the sand starts running out to when we can actually do a case. And then once the case is scheduled, we run a specific ERAS protocol, which is enhanced recovery after surgery. It's a certain group of prescribed medications I use to control nerve pain, decrease inflammation, decrease nausea. And you'd start that the night before surgery so that when I come to see Tiffany the day of surgery and mark her, she's had a good night's sleep. She's not nervous, you know, and she's got a great mindset. Some people obviously are very nervous. So we're all in alignment with the way you go into surgery is very, very a resident of how you come out of surgery. So if you come in and you're all stressed out, then typically your wake up is not going to be as calm. So we want everybody, they'll do a block in recovery before we ever go back. So we have a much different program than most people. I'm super fortunate. I recently interviewed our president of anesthesia that we use, and they've done a great job, helping our patients. So with all that being said, we'll let Tiffany chime in here, and then I can go over kind of some findings and clarify the picture.
Right. In the protocol before the testing, we did determine I have, parasites, toxic mold, and heavy metals. I had all those things. And I knew in my mind, I knew that I was not going to come out and just be perfect. Like I wasn't going to be healed and fixed. And I have heard there's people that way, but I have to say, I'm very honest, and I was hoping I would wake up in surgery and go, okay, I'm done. I feel fabulous. But it took time and it took work, and
Right.
I did, it came out, and of course I'm out of, anesthesia and everything, and, just had my implants taken out. But, yeah, the work ahead of time and the post work. And, I'm always telling that. I've talked to you on my podcast, and, I'm still working on myself. I mean, still not quite a year out, and I'm still trying to get cell core done and all those things. And I know you'll talk about that, but the expectations that when I saw you in July of 2023, I understood perfectly the task. You know what I mean? I understood.
Yeah, that's the, I will say, and I've talked about it, and it's the hardest thing that, we work with is people have a lot of limiting beliefs, a lot of, trauma and other things they don't deal with before they, come to see us, obviously. And then now we have this very, image altering, body altering procedure. That's why I say I don't tell, and I let everybody know, I don't tell anybody they need anything. I'd listen to you. And in Tiffany's case, is very like, to me, it's like open
Mhm.
and shut, like what's going on. Unless you practice head in the sand medicine, it's pretty simple to hear her story and go, oh, well, you had an implant. For everybody listening, that's foreign body, right? Your body encapsulates that. About 29% of those will have bacterial contamination. That means somehow bacteria gets on the device and that stimulates your body's reaction to the device. So when I explant someone, I'm always trying to take out all the capsular material, and this goes back to being someone who did and mostly worked in the cancer space. So if we're taking out cancer, for everybody listening, I don't take it out piece by piece. So we want to take it out like an undisturbed Easter egg, is what I tell everybody. I don't want to see the candy inside. I just want to take it out and not break the shell. Now, that's not always feasible in each case. The thicker the capsule, the easier it is, the more feasible that is. In Tiffany's instance, we get all the material out. And so everybody listening, I have a very specific process I follow. So I'm trying to take everything out intact all the time. And then once we're done with the procedure, whether it's explant, explant and lift, explant and fat transfer, or explant and lift and fat transfer, whatever the combination of things I'm doing is, I'll go to the back table and we'll do a little set of still photography and then a video. The thing that's unique in Tiffany's case is when I was taking out one side, the right side, I felt like a little unicorn projection. It was not normal, didn't feel right. So I just took all of it out together with the capsule. And it was very deep and posterior, in fact, on her capsule. And we took it all out. I have a great picture of it. It looks like a little unicorn sticking off of the capsule, little unicorn horn. Sorry, not the pony, but the horn. And I said, well, we'll send this back. And I told you, like, I took this out and it's in here and I don't know what it is. And then we send a thumbnail size piece off for PCR analysis by Microgen DX. We'll give them a shout out, even though I don't shout out companies. Then we, have a 1 to 2 week period of an office work where most people who travel from Asia and Europe, they're going to stay 2 to 3 weeks because long hauls are very difficult for acclimation before surgery, then recovery, and then travel back. So my patients who come that distance, they're going to stay here 2 to 3 weeks. So everybody listening from out the country, that's the program. In the country, because our country is so big, it's our stance that you need to stay about a 7 to 10 day window just to take advantage of everything I have in the office, which is hyperbaric oxygen, lymphatic massage with Flopresso. I have 3 of those, no waiting on those. And then we have red light therapy. We have Nano V. We have all the things that really expedite recovery, as well as a great relationship with a restaurant called The Well. It's gluten-free, yes, dairy-free, no seed oils. And then you got to work on your rest. I know it's hard when you're away. For everybody listening, I just got back at 2 a.m. from a meeting, so I'm well aware of being gone and how sleep it's disturbed. You got to prioritize your sleep. During that time frame, I don't have the results that I'm going to discuss now about Tiffany. And then usually at a designated time between like 3 and 7 days, the pathologist will call me when they're freaked out about something. So this call came and, they're like, hey, we see breast cancer on this slide. I'm like, okay, well, I'm pretty comfortable that I took all of it out, but until you tell me that it's not out, I don't know that. So for everybody listening, I don't get excited until I have all the information. And then I still don't get excited because all that matters is Tiffany's health and not my excitement. So the pathologist always gets like very hyped up when they call me. And I'm like, okay, well, I told you, I knew there was going to be something on this. So let's just, let's hear what it is and get it sorted out. So, so we had that, in the background already going on. And so that's the report I always get back first is the pathology report. And people ask me like, why I do, send this to pathology? Well, everybody listening, this is why you send it to pathology, because Tiffany had a ductal carcinoma in situ, a breast cancer. And so for her, I guess we can bring up 2 things. There's health span and there's lifespan. Things going to end your lifespan is a heart attack, stroke, cancer. So we don't want to have those things happen. And if it's a cancer, you always want to identify it super early because the earlier you identify it, the more treatable it is. And so that's how everybody's mindset should be. And so we found this, and this was a very deep cancer in her breast, which is always hard to identify, very close to the capsule, which is why I identified it on removal of her capsule. So she's had all this screening. She's in good shape. So that's the most important aspect of this is to, 1, have found it, 2, have, cleared it for her. And it's completely cleared, and now she's surveilled. So she's on the right track with that. And then about 2 weeks later, I get this fancy PCR report back. And all of her trouble, if you remember, was on the right side. So let's read her report here. And her report, which of course my screen clears off. So on the right side, her PCR analysis showed Staphylococcus epidermidis and Cutibacterium acnes. So in the beginning of this year, we'll say January of 2024. So we timestamp this, we mark this, we know this. A scientist published a paper and it showed that Staphylococcus epidermidis readily produces biofilm, which we already knew, but it's found in higher concentrations on patients with symptoms of breast implant illness. It's found in their bloodstream at a higher concentration, meaning, the staph epi is found on the capsule, just like we're going to talk about yours. And the interaction between the bacteria, so the staph epi interaction with your breast tissue, creates a molecule called oxylipin tinhome. They've shown that this molecule is higher in patients experience symptoms like Tiffany was, and they can inject that little molecule into a rodent model and reproduce symptoms of fatigue. So that's called translational research. It's the first time ever it's been shown. It's a very, very cause and effect paper. Fast forward now, I apologize for the delay in publishing our paper, but we set the incidence of this at 29% in explant specimens because we recently published my series of over 694 samples, I believe, because I do this for every patient since 2019. And it's a small sample of my patients, but it took forever to get written and published, so I apologize. So what does that mean, everybody? Well, I told you as soon as I heard her story, I anticipated that her device was contaminated. So it's most important for Tiffany's long-term health that this get performed properly, so that one, and in this is probably the best example I can find of this in my practice, where there's a deep lying cancer that's associated with the capsule material. So this is why I take them out. And I really don't care whatever other people say about this. That's not, this is a non-starter for me. Like, I do this for every patient. My sister was a breast cancer survivor, recently passed away this year. So I would never not do this in a case. Because that's the way I was taught in terms of this is the most oncologically sound principle to follow. So when we found a breast cancer, that is off the table because she's taken care of for that. And then two, this was clearly a device that had bacteria on it. And for everybody listening, mold is not a thing in devices. I published this huge paper about this to stop this nonsense about mold. So if you have two bottles of, Pellegrino filled with water, and you replace one of the bottles water with silicone gel, okay, you really can't have mold in the silicone one. All right, so that takes away that whole group of patients. The only time you could have, if you're saying mold or mycotoxins in it, is in the saline filled device, but that saline filled device is filled with sterile saline that you get your IV drips through at your vitamin bar or your wellness place, and you go in there and get that, no problem. So in the operating room, we have sterile technique, and it's my feeling that this mold thing is much to do about nothing other than trying to get views, clicks, and scare the crap out of people. It's not a thing. So I don't know how many times my paper is published in Microorganisms. It's open access. We'll put links of it in the show notes. You can go to my YouTube channel. You can read about it. These things that I'm talking about are based solely on evidence through either patients, scientific laboratory research, and or specimen analysis. Like, there's no way to make up what I'm talking about. So this is not, these are the facts. And I'm happy to debate anybody who wants to sit and chat with me about it. But there are no other things in this thing. These are, cause and effect has been identified. Staph epidermidis, Cutibacterium acnes, readily produce what's called biofilm, which makes it hard for your body to clear. and the interaction between that and your breast tissue, specifically the oleic acid, creates this molecule, oxylipin 10 home. And before you send me 1,000 DMs about can I test for this, the short answer is no. That's a research tool right now, but we're going to work hard to get that into a platform for testing.
Amazing. Amazing.
So obviously, I had to call Tiffany right away after surgery and tell her, like, this is what I anticipated. There's nothing at this point more to do other than wait till we get our final pathology. And then I spoke to her breast surgeon, and it's never for everybody listening. It's not a easy conversation to have with someone who you're taking care of, and it creates a lot of um, obviously anxiety and concern amongst themselves and their family. But the most important thing is how you do this. And then, I spoke with Tiffany and tried to have a very clear discussion with her about my feelings about this and how we should, tackle this problem if it became, more of a problem.
Right. Right. And after when you did, you said I didn't get excited. Oh, I was excited when I saw that word on the pathology. But of course we very quickly found an breast oncologist in Dallas, and that took care of me. But now I'm high risk, obviously. And so it was an MRI in December and a mammogram in June. And that's just my life which is fine. But I have a question for you. 2 months before I had surgery, I had surgery November 9th of 2023. 2 months prior, I had a full mammogram and was tested, and they didn't detect any of what you found. And I've had a lot of people question me, ask me why it wasn't found. It just wasn't detected. So what do you say about that?
Yeah. So, when you're doing mammograms, we're looking for microcalcifications. And this is right up against a, capsule. So that's the problem with yours in particular. And they've shown in study after study that it really doesn't change the, if someone has breast cancer, has implants, it really doesn't change the staging when it's found. Because most of the MRIs and or ultrasounds and or mammogram combos, however that works out, whether you have easily imaged breasts or you have dense breasts, now there's a combination of ways to identify it. But it's been published for many, many years that it doesn't change the incidence. But so in your case, it wasn't clearly, visible based on those techniques. And I just found somebody, recently who basically had a few cells of cancer. So that's never going to be picked up.
Mhm.
So in breast cancer, you got to look for ductal calcifications. So that's how they pick it up on mammogram. Yours is more like that little unicorn horn. So it's very like just kind of isolated off to the side. And I knew it wasn't normal because obviously I've done thousands of cases. And so, when I feel those things, I'm like, oh, yeah, we got to make sure that we handle this slightly differently and adjust. And obviously, we can do that with my team in the OR. But I think in the future of breast imaging, my friend Dr. Jen Simmons in Philadelphia, we'll give her a shout out. She's leading the charge to change to something called QT imaging, which is a high resolution ultrasound technique that gives better imaging. And I feel like that's the future of imaging. And our country's so big, sometimes I wish our country was smaller. It'd be a lot easier to do things. But so she's an incredible entrepreneur and advocate for women's health, former breast surgeon. Really, that's her whole mission in life is to get that imaging on board to reduce exposure to radiation from all the other imaging techniques. And so that's probably overdue in terms of adding that next layer. But it's not obviously easy to do any of this. And we still have to screen patients who have had breast cancer, had mastectomies, and have implants. And because about, we'll say 94 to 96% of the tissue is removed that could cause a cancer, but obviously that leaves some there. And so many times they're still getting mammograms for that, for the very reason you're describing, because it's rare, but it can happen and
Mhm.
be missed. So
Right. Absolutely. Absolutely. Well, I'm still working on myself, to say the least. I think I'm just a project.
that's probably that's a great way to then I I appreciate you saying that, because although many of my patients go on the different platforms and they're immediately in recovery feeling better. So I'll clarify why I think this happens so everybody understands. So everybody has a genetic playbook, which we look at in the beginning. And then two, what is your toxicity burden? And then how have you been doing things? Now, that's a big, complicated environmental stressor, emotional stressor, psychological stressor, what you put in your body, how you sleep, how you eat, what's your hormone balance. Just because I do an operation to take out a device, and in Tiffany's situation, it was in, quote unquote, bacterially contaminated low grade infection, however we're going to describe that. That's a big driver taken away from her immune response. But it's not the only thing driving her immune response. So we look at toxicity burden very carefully. She's already a very good student in terms of the quality of the food, the fluid, and the air that goes into her body. So people wonder why, like, I harp about sleep and I harp about food and I harp about don't drink out of a plastic water bottle. Like, don't come into my office with some smart water or Fiji or anything. Like, either we'll give Path a shout out, or anybody who's using recycled aluminum or use a Yeti or a stand, whatever. I don't care. Don't come in here drinking out of a plastic water bottle, because the phthalates in the plastic get into the water and can affect a woman's hormonal balance. We'll just put it that way. So phthalates are a common problem in my patients, as well as glyphosates, which are how our food gets treated to avoid, pests. And, that gets stuck on the food and that gets in your system. So there's all
Ugh.
the things that go on. And then air quality is kind of I got my guy, Michael here, who is the CEO of Jasper Air Filters in Austin. And I have a Jasper on the other side of me right here. I can hear it running. And so, like, these are all the things that you have to be consciously thinking of. And if you ignore one and don't address the others, it's not going to, advance in the way that you want. And we want everybody getting well, and I want everybody getting well as fast as possible.
Mhm.
So the
Yes.
book and my recovery program, Sharp, is based, on these fundamental core principles we discussed. And there are some things that are going to come in the future, but much like Tiffany said, an explant is only part of the process. And to me, the work really gets done through my team, led by my patient and detox practitioner, Chelsea, and she's my lead detox person. Shout out to Chelsea. Everybody loves Chelsea.
Yes.
And it's going to go on for a period of time. And I want everybody here the number a year. Like,
Mhm.
give yourself a break. If you had a problem since 2011, like Tiffany, I'm not going to solve it in an hour or two in the operating room. So please don't think like that. Get yourself
Yeah.
ready, prepared mentally, physically, emotionally. Get your spouse on board, your loved ones, your partners, your whoever's going to support you, because it's not a sprint. It's definitely a marathon.
And I want to add to that too, because after surgery, January, I started my clean, we went through that shock, and then January started cleaning up my gut, and then started cell core, and it just, my body was not quite ready. And I'm
All right.
still, I mean, but you know what? I'm going to finish that cell core. But it's just tough. My body's just not reacting like I would like, but I know that I still have work to do. But, I just, again, it wasn't, you did get the inflammation out, the cancer out, but then I just keep telling people that come to my platform is like, why aren't you better? I'm getting there. I feel better. Oh gosh.
everybody listening, Tiffany is better.
Yes.
Like when you take cancer out of your body and you take something infected out of your body, you're better. So
Mm.
the degree with which she recovers is, to her credit, her pace. She's a bio individual. So everybody listening, this is why I don't advocate for what, many of my I have wonderful patients, but they'll go on and like many patients do around the country, I feel, all these things in the first day or the first week, and it sets up a really unhealthy expectation in clients who are going to go through, like everybody's going to go through their own journey about this. And we built a whole program to help with this. Before, I did not understand this clearly, but now we're learning and growing with our patients and developing, what we feel is best in class in programming to help them in this process afterwards.
Right. And I highlight because with the help of you, what you have helped me, and then I'm starting to help people as well on my platforms. I highlight just, month after month or week after week how I feel. But it's very important that I say, this is how I am recovering. And we're all different. We are all have a different footprint. So it's and I just make that perfectly clear. Do not feel like I was working out faster than y'all because everyone's different. So
Exactly. So I'll summarize it this way. We set up the program to help patients. We've increased our ability to do and provide more surgical care, and then we're expanding our detox team as well to accommodate obviously new patients as quickly and efficiently as possible. But it's not just about doing an explant surgery without all the other aspects of the program. And you'll probably, if you talk to me, um, understand that I know you've met with or sought out help for this because many patients do. I'm just going to have you do what I know works, which is run our program like Tiffany is running, and we'll support you through that process. So I want to thank Tiffany for coming on the show, but I want her to actually give her information. So if you want to follow her story, you can do that and find her on all the fancy platforms.
all the fancy platforms. I'm Tiffany C. Blackmon on Instagram and Facebook and Pinterest and all of them. And my podcast is my so-called fabulous podcast. We're on all platforms. We're 5 years old and just trying to solve problems. But and I'm going to say this one more time to this man. He's so humble. He saved my life by I accidentally found him, and I praise that I found him. And he can save yours too. So thank you.
You're welcome. And everything happens for a reason. Everything counts. Every second matters. And everything you put in your body makes a difference.
Absolutely.